If you experience mild heartburn twice a week or severe acid reflux at least once a week, you may have acid reflux. An article in the World Journal of Gastrointestinal Endoscopy reported that among we elderly, heartburn or acid reflux is the most common upper gastrointestinal disorder. The article also said that although seniors with heartburn may have fewer symptoms, our heartburn is often more severe. Hi, I'm Joshua and I am here to help you with your stomach pain relief here in the Stomach Health channel. Now, let's continue with the video. Exactly what is heartburn, gastroesophageal reflux disease, and why do so many seniors get it? Once you have acid reflux, you'll recognize it forever. A burning sensation in the chest or throat. Even the taste of stomach acid in your mouth. Sometimes it can feel like a dull pain in the chest, and that raises the issue of heart attack. Here are some questions and answers from a patient with acid reflux. How do we know it isn't a heart attack? It's often difficult to distinguish between acid reflux and a heart attack, even in a hospital emergency room. If you experience dull pain in the chest and sweating, shortness of breath, or arm pain, call 911 and get to a hospital ASAP. Then do the necessary follow-ups with your physician, even if the emergency room doctor and hospital lab tests are negative on a heart attack. Common triggers for acid reflux: a little too much wine, BBQ ribs, a late evening coffee, and I know I'm in for heartburn the moment I lie down to sleep. The most common triggers for acid reflux are smoking, having a large or late night meal, eating fatty or fried foods, drinking coffee or alcohol, even taking a single salicylic acid tablet, aspirin. Although there are many common acid reflux triggers, everybody is different. My son, who started having reflux a few years back when he was in his mid-50s, finds that tea is a trigger, as are some cookies, fatty fish like salmon and soya ice cream. He's lactose intolerant as well. And while he can tolerate a beer, red wine is out. How about you? What are your reflux triggers? No doubt, my heartburn has become worse as I've aged. That little sphincter that lets food in and is supposed to keep stomach acid from leaking up into my esophagus has weakened over time. A long time. I'm 84. And sure, I do exercise, but no number of arm curls is going to strengthen that sphincter. I can remember a little heartburn from time to time when I was younger. But there's no question, no matter how tempting they are, BBQ ribs and some other good stuff are off the menu now. Some medications can worsen your heartburn. Asthma, which I learned 6 years ago that I have, often occurs together with acid reflux. Who'd have thought? In fact, each can worsen the other. If you have this uncomfortable combo, ask your doctor to confirm that your asthma medication isn't making your acid reflux worse. Canada Drug Guide, which is funded by Health Canada, lists the following medications as possible contributors to acid reflux: anti-anxiety medications, sleeping pills, calcium channel blocking drugs used for heart disease and blood pressure control, some asthma medications, aspirin, salicylic acid, pain medications such as ibuprofen, Advil, Motrin, naproxen, products with iron content, antibiotics called tetracyclines. Talk to your doctor about your acid reflux and how to manage your discomfort while still using the meds you need. Heartburn is more serious than just a pain. Prolonged heartburn can cause serious, even life-threatening, complications. According to the research, the older you get, the higher the possibility of prolonged and more severe acid reflux, which suggests that any senior with endless heartburn would be smart to ask their doctor about it. Here are 3 complications for seniors from heartburn that the Mayo Clinic says could occur with prolonged acid reflux. Scar tissue in the esophagus that narrows the passageway and makes it difficult to swallow food. A painful open sore in the esophagus that also makes swallowing difficult. Tissue changes in the lower esophagus that are associated with esophageal cancer. The good news, those over-the-counter heartburn remedies work. If you're like most people, your acid reflux will likely respond to lifestyle changes like ditching the BBQ ribs and over-the-counter products. What would you think about these? Have you experienced this or tried some? Comment down below your experiences. And if you think these are useful, a like and subscribe would be really awesome for the growth of my channel. And also, don't forget about the bell icon below. Let's get it on. Antacids. Canada Drug Guide says that all antacids, such as Tums, Rolaids, and Molox, work as well as each other. None works any better, tablet or liquid. The choice comes down to your preference and price. Antacids neutralize the acid already at work in your stomach. A glass of water may work just as well. Although there is some thinking that antacids can actually encourage your stomach to produce more acid, many people do find them effective when used on an occasional basis. H2 blockers. There's another class of remedy for acid reflux called H2 blockers. H2 blockers reduce the amount of acid in your stomach. Ranitidine, Zantac, and famotidine, Pepcid are non-prescription, over-the-counter H2 blockers. In certain circumstances, your doctor may prescribe higher doses of an H2 blocker. These prescription products include Cynidine, Tagamet, Ranitidine, Zantac, Nizatidine, Acid, and famotidine, Pepcid, proton pump inhibitors, PPI. If those don't address your heartburn symptoms, your doctor may step you up to a proton pump inhibitor, PPI, such as lansoprazole, Prevacid, omeprazole, Luzec, and pantoprazole, Pantalon. They may be more effective, but cost more. Note that there are serious risks associated with taking PPI for heartburn. Many physicians will prescribe PPI for their clients for years that long-term use has been linked to a heightened risk osteoporosis and bone fracture. The Government of Canada specifically notes, healthcare professionals are reminded that PPI should be prescribed at the lowest dose and shortest duration of therapy appropriate to the condition being treated. The Government of Canada also warns that there is a possible association between the use of proton pump inhibitors, PPI, and an increased risk of Clostridium difficile-associated diarrhea. U.S. Pharmacist states, quotes a study by Lambert A.A., Lam Jo, Paik J.J. et al., that found that outpatient PPI use is associated with a 1.5-fold increased risk of community-acquired pneumonia, with the highest risk within the first 30 days after initiation of therapy. PPI therapy also increases risk for hospitalization for community-acquired pneumonia. In addition to the above, there is evidence that PPIs can actually cause rebound symptoms, and that there can be a clinically meaningful increase in acid production above pretreatment levels when treatment is stopped. Be sure to discuss these issues with your doctor if he or she prescribes a PPI, and be sure to be checked regularly for these negative effects if you do need to stay on PPI. Prefer natural solutions to your heartburn. You may find that natural lifestyle changes can reduce your heartburn. Watch what you eat. Give fatty foods a pass. Watch when you eat. Late-night meals are no-no. Watch how much you eat. We all overdo it from time to time, especially at large family celebrations. But if you do, get ready to pay the price. Watch your weight. Obesity increases your risk for heartburn. Ditch, or at least moderate your alcohol and caffeine intake. If your heartburn is frequent, try raising the head of your bed. It's got to be at least 6 to 8 inches. Just piling up pillows is not effective and may be uncomfortable. You have to lift your torso, not just your head. Heartburn remedies for seniors. As a senior, you may prefer traditional acid reflux remedies. 2 of the acid reflux remedies below have some scientific validity. The others, some people swear by them, but there's no scientific proof that they work. Baking soda, sweetened with a little honey. It will temporarily neutralize stomach acid. Try a heaping teaspoon in a tall glass of water, sweetened with honey or sugar because it tastes awful. Don't overuse it unless you enjoy belching, bloating, stomach cramps, and slight pain or discomfort. There has been some scientific validation for this approach. Chew gum. Chewing gum immediately after a meal for 30 minutes to an hour produces a real decrease in acid reflux symptoms according to independent scientific studies, and can help soothe the throat by encouraging saliva production. My son swears by sugarless juicy fruit. Definitely stay away from peppermint, mint, or spearmint flavor. They only make things worse. Apple cider vinegar, a tablespoon, mixed with honey and water, is believed by some to alleviate heartburn symptoms. There's not much research that says this is so. Try a cup of warm ginger tea. There's no evidence that confirms it works on acid reflux, but it may have a calming effect on your digestion. Be sure the ginger tea contains no caffeine. And many people find it's a good idea to avoid drinking anything for at least a couple of hours before bedtime. Probiotic supplements. You can get probiotics in yogurt or buy a supplement. Some researchers have theorized that daily use of a supplement can make the lining of the gastrointestinal tract stronger, thereby protecting it from bacteria and excess acid. Gaviscon, a different kind of acid reflux treatment. Although he's not a senior, my son swears by Gaviscon. This product creates a protective barrier between the top of your stomach and your esophagus, throat. This barrier prevents stomach acid from splashing back up refluxing into your esophagus, essentially performing the function of your lower esophageal sphincter, less. Blocking acid reflux, in turn, prevents the painful sensation of heartburn. It's extremely painful on your chest when you have acid reflux. You just want to make it go away. What if I told you you could make it disappear into oblivion without making your throat hurt? Eating the medicine like a candy. Well, this is what Pepcid does. Chewable mint-flavored candy like medicine that would make your acid reflux pain disappear for a whole day. Don't just take my word for it. Look at these 3,000 5-star rating. It's also important to remind you that I'm in no way sponsored by Pepcid. It's just a great brand that I found on Amazon to be an affiliate. This means that if you'd like to buy Pepcid, clicking on my link in the description would help me massively because I would be receiving a commission for each purchase. What do you think about these information? Do you think it's useful? If it is, support this channel by giving it a like and subscribe. And also don't forget to click the notification bell for more interesting facts like these.